We now return to Mark Willis and Road Dog Trucking News on SiriusXM's Road Dog Trucking Radio.
Okay, I want to welcome you back, ladies and gentlemen, and always a great honor to have on board Dr. Fahmi Farah, cardiologist in the Dallas-Fort Worth area, and recognized all over North America. And, Doctor, it's always great to have you on the show. I want to welcome you back.
Thank you. It's always great to be on your show.
Well, I appreciate that, and, it's all about sharing the knowledge and the information for the listeners out there, and want to start out and talk about a story that I was reading just this morning, as a matter of fact, about a story out of the state of Florida indicating that in one of the school districts, they've got a measles outbreak. They've got one school had 6 cases, other schools are reporting measles cases as well, and this got me to thinking back when I was a child, early on, about getting a measles vaccine. And this led me to the thought about, well, if you're going to get maybe a measles shot or a booster shot, could that cause any heart-related issues on the surface? Any thoughts about that, vaccines?
The measles virus is fairly safe. It is something that we get as children usually, and there are some boosters that we have to take a couple of times. As far like the measles itself can cause quite a bit of problems. So the vaccine and staying up to date on your boosters is very important, particularly when it comes to the heart. The virus itself doesn't really have any known adverse effects for the heart that's common, but the virus, without being protected with the vaccine, the virus itself can be problematic for a number of things. Measles is not a fun thing to get, so being protected is a good idea.
Okay, very good. Absolutely. And the other thing about that as well, that we're going into, I think, the last stages of the flu season, hopefully, that I think it expires or it's done maybe at the end of March. If somebody is wanting to go out and get a flu vaccine at this point, with only about 6 weeks left in the flu season, would you recommend to that person that's thinking about that to talk with their doctor if there's any heart conditions, underlying heart conditions that the general practitioner needs to know about, and maybe not give that flu vaccine? Could there be any adverse effects with the heart?
Actually, when it comes to the flu, getting the flu itself can have more adverse effects for the heart than getting the vaccine itself. Of course, I do recommend everybody to talk to their doctors first, especially if they have any allergies or anything like that. They should talk to their doctors before getting the vaccine. But generally speaking, the vaccine is fairly safe, and it actually can save people from getting severely ill during this period of the time. Even though there's little window left of the flu season, I still recommend people to get the vaccine as long as they're eligible for the vaccine.
Okay, very good. And when you are looking at, say, a potential patient, it's important for them to be able to tell you, maybe, doctor, I've got diabetes or I've got underlying heart issues. This helps in the healing process once you've got a very thorough, comprehensive history of that patient you're looking at. They got to tell you right up front what's going on, right?
Oh, absolutely. For those who have symptoms or pre-existing heart conditions, your doctor needs to know right away. And risk factors as well, things like high blood pressure, high cholesterol, diabetes, those are all strong risk factors for cardiovascular disease. So those who have those, you need to see your doctor routinely and let them know what's going on with your health.
When you mention cardiovascular disease, how do you treat that? Say someone hears that, say you give them the diagnosis, hey, you've got cardiovascular disease. Is that an automatic alarm bells going off or should go off for that patient, maybe to change their regimen, what they do on a daily basis?
Yes. When you hear that you have cardiovascular disease, there are certain alarms that should go off. And, the term cardiovascular disease is a broad umbrella, and underneath it there are various different types of conditions. For example, heart attack is one of them. That's a cardiovascular disease. There are many different types, rhythm problems, heart failure. Some people are born with congenital heart disease, so all of that falls under cardiovascular disease. So, and the treatment could be very different based on what kind of condition you have. So, and the regimen, treatment, preventative measures, they can all be very different. So you do need to talk to your doctor, and depending on what the diagnosis is, you will have that specific treatment that you should adhere to. And, of course, preventative measures like eating healthy, exercising, smoking cessation, not drinking too much alcohol, these are all very important.
You mentioned stopping smoking, and a relative of mine is trying to stop smoking, really trying very hard, but what he's running into is that trying to stop smoking, he still smokes, trying to get himself weaned off of it, but he's also wearing the nicotine patch at the same time. Is that kind of a double whammy with a heart when you're doing both like that when trying to stop smoking?
Not necessarily, no. The smoking cessation is more important, and nicotine patch and gum, they're both, good ways of stopping it. So, no, those alone would not have any adverse effects on your heart as much as smoking itself would.
Okay, let's do this. We have to do the commercial break, and when we come back out of the break, Doctor, there's a report out, new one, on NBC News, that women reportedly will see greater health benefits from exercise than men. And the report indicates that 30% of the women, there's a lower risk of fatal cardiovascular problems. Men, an increase of 11%, lower risk of fatal cardiovascular problems. And let's get your thoughts on that when we come back. Do women see maybe greater health benefits from regular exercise? Everybody's got to exercise. That's the bottom line. Men, women, whatever. You got to get out there. You got to walk those steps, or maybe lift weights, or whatever you like to do. The bottom line, you got to get moving, and especially in this driver population where most of you are sitting 11 hours a day, just driving. 14-hour duty cycle really can take a toll. Feel free to join us. Dr. Fahmi Farah is on the line with us, and bring any questions you've got to the table. She's not here to diagnose you over the phone, obviously, but to give you that medical information you need to send you on to your doctor and let them take over from there. Dr. Fahmi Farah is on with us, and one of the most notable, recognized names when it comes to cardiology. And, Doctor, thank you very much for joining us on the show. Let's get your website out. Where can folks find you up on the web?
People can find me at www.drfahmifarah.com, also at Fahmi J. Farah on Instagram and Twitter.
Outstanding. Thank you very much for joining us on the program. All right, this story that I saw on NBC News came out earlier today, as a matter of fact, about, it states pretty much, and I'm going to paraphrase, that women see greater health benefits from exercise than men. We've got a lot of women drivers that are out there, and this is interesting news. How do women benefit more, in your estimation?
In all honesty, I believe exercise is something that can benefit both men and women. And when it comes to cardiovascular disease, women actually can see damage from an earlier stage compared to men, especially when the effects of high blood pressure. We've had a study that showed that when it comes to high blood pressure, the damaging effect on the vascular system itself is something that happens at an earlier age for women. And so for those reasons, for women who exercise and mitigate those risk factors, the benefit is a little bit higher.
Okay, goodness sakes. And when you mentioned maybe a little bit higher with the benefits, would that be maybe higher levels of estrogen, maybe enhancing the blood flow? And I'm reading from some of the notes on the NBC story, more capillaries, for example, or tiny blood vessels allowing for blood flow, oxygen flow?
Exactly. So it improves all things, particularly like when it comes to capillaries. Those are blood vessels. Those are very micro blood vessels that are branches within our entire body, actually. And so when we exercise, it increases the capacity within those. So it improves blood flow overall for your entire body. And that's, of course, good for the heart as well.
Okay. And this is why, drivers, it is so important for you that if you're going to get your DOT medical card renewed, if you're just going in for a general checkup, tell the doctor what's going on with your heart. Are you feeling abnormal chest pains, for example? Do they come and go? And some of you might chalk it up to, well, maybe it's just indigestion or I'm just getting older kind of a thing. And Dr. Farah, when you are talking with somebody and you're diagnosing them, and they've got some kind of maybe chest pain or something going on, like maybe pain in the arm down the left side. Do many folks maybe say, well, I'm just getting older. It's just the way it is. What do you say to that? Do folks talk up to that?
Yes, I do hear that quite often, as a matter of fact. And my advice is it doesn't have to be that way. You know, it's never normal to get heart disease, and in a lot of people, one of the most common symptoms is actually fatigue, and often people have had that for so long that has become their baseline. So they have forgotten what it feels like to have a normal cardiovascular system. So my advice to all who are listening and all my patients as well is to not assume things that's normal. It's always a good idea to talk to your doctor and let them know what your symptoms are. And proper testing to be done. That assessment is very important to be able to figure out what's actually happening internally.
Yeah, and this is an excellent point to bring up, right, that general practitioners are really the first line of defense, I would imagine, that when somebody goes in for a general checkup, just annual or maybe for whatever reason, that physician should be able to determine maybe if there's an irregular heartbeat, if there's atrial fibrillation going on, simply by maybe just using a stethoscope. A whole lot can be learned through that, right?
Oh, absolutely. Our primary care providers are so important. They're the first line of care and defense. And so it's very important for them to detect those things and send them to the specialist like a cardiologist like myself in a timely manner. Because what I tell people is that, you know, while heart disease is the #1 killer for both men and women, the silver lining here is that 80% of that is preventable if you come on time, if we take those proper measures and treatments and preventative protocols on time.
Yeah, doctor, you find some of the patients say, I just don't believe it, that I got a heart problem. That never happened to me before, kind of a situation. There's a lot of times, does denial play a role in this? How do you see that?
It does far too often. You know, denial is such a terrible thing because something that could be prevented, it steals that opportunity away from that patient. So, you know, if the patient is with us, like, you know, in front of me, I, of course, take my time to talk to them and educate them and provide the proper information and resources that they can read up on so that they can get out of that denial stage and actually allow themselves to be treated. Because treatment is so great now, like I said, of course, 80% of all of this is preventable, but also for those who have already been diagnosed with heart disease, there's really great, technologically advanced treatments that are available that can in many cases reverse that problem. So I encourage everybody to, not be in denial and be forthcoming about your symptoms because there's help out there.
All right, absolutely. And as far as surgery goes, I know that you will perform surgery on the heart, and this has got to be, I would imagine, a good time to be in medicine because of the technology that is at your fingertips with such precision, accuracy. You can go right to the source of the situation, get done what needs to get done, and that helps with the recovery time, right? Got to be a good time to be in medicine with this.
Yes, you're correct. You're absolutely correct on that. Technology is great, and we're very, very thankful for that. You know, science, medical science, is very advanced right now, particularly in the field of cardiology. We have great technology, great science, and there's a lot we can do to help our patients, and so it's a great time to seek help.
All right, absolutely. And drivers, again, the call goes out, exercise, whatever you can do. Walking around the truck, man, you know, maybe carrying a bike with you and hitting some of the trails, maybe close to the truck stop, or even if you're back home, maybe ballroom dancing. Right, Dr. Farah? That's a lot of fun.
Yes, ballroom dancing is very fun, and I encourage everybody to stay active, whichever way you find it to be fun and feasible.
All right, absolutely. And, hey, it's okay to brag. Tell folks what you won just recently about ballroom dancing, right? You came in #1 just recently?
I did. Yes, I won the national championship for ballroom dancing. I'm very grateful for that, so thank you.
Absolutely, absolutely, and make it fun. That's the name of the game. But certainly keep at it. You got to stay consistent with it. Dr. Fahmi Farah on the line with us. Doctor, always a great pleasure. Let's get the website out there one more time where folks can find you. Where can they go?
You can find me at www.drfahmifarah.com, also at Fahmi J. Farah on Instagram and Twitter. I also have a podcast available. It's called Queen of Hearts Podcast on YouTube.
All right, very good. I'd love to learn ballroom dancing. That's got to be a lot of fun and certainly very beneficial. Doctor, thank you very much for joining me on the program. That is Dr. Fahmi Farah on the line with us.